Good morning. Today's topic is root canal therapy. For many people, this is a very scary subject because they've heard stories of a friend who had root canal and it was horrible, they were in so much pain. But I would like to give you some real-world demonstration of what it's like to get a root canal because it doesn't have to be scary, it doesn't have to be painful, and for most patients it's not, okay? Now the reasons why you might need a root canal, most commonly it's a cavity that we just waited too long. It got so big that it reached the inside of the tooth. Once that happens, that infection can spread from the inside of the tooth to the tip of the tooth to the surrounding tissues like the bone, and eventually it usually ends up as a little pimple that comes out on your gums. So that is one common reason why you need root canals. Another is if the tooth is somehow injured and maybe there's been an accident or trauma, and then the inside of the the inside of the tooth, the tissue there becomes necrotic. That means it dies. And when that happens, that sort of process of the tissue dying, called necrosis, that could be an indication to take that tissue out as well. And generally these teeth, especially if they're in the back, they don't get a filling at the end, they get what's called a crown, which is a cap that goes on the outside of the tooth. Reason for that usually is because after root canal therapy, the tooth doesn't have its same elasticity. It tends to get a little bit more brittle, which lends itself to breaking more frequently. And it's been shown that if you put a cap on the tooth, especially in the back, after root canal therapy, it is less likely to break. Okay? Once the tooth breaks, it's oftentimes not restorable. So we only really do root canal therapy as a heroic effort to save the tooth, because the alternative generally is to not save it, abandon it, and to give up on it and take the tooth out. Okay, so if the tooth is not what we call restorable, we can't fix it, then the alternative is just to take it out. Don't try to fix something that can't be fixed. Okay, so root canal therapy, it can be a great way to save a tooth. And it doesn't have to be painful, and it doesn't have to be scary, because what we do, first of all, you go numb. The first step of root canal therapy is anesthesia, so you have to get nice and numb. And then what we do is we place a little barrier between the tooth and the rest of the mouth. That's called a rubber dam. Okay, and the reason why we do that, we actually use bleach to disinfect the inside of the tooth, and we don't want you swallowing bleach. It also protects the root canal therapy because your saliva has bacteria that can recolonize the inside of that tooth and start up another infection. So we want to do two things: ensure that we don't harm you during the root canal procedure, and we also don't want you to harm the tooth by introducing bacteria in there. So we create this barrier called a rubber dam, and that's the second step essentially. Once that rubber dam is on, we just pick a little hole on the top of the tooth so that we can pass these instruments to clean out really nicely the inside of the tooth. We put things like anesthetic and also the irrigation, the bleach, to sterilize the inside of the tooth. And then at the end, we put a filling material that goes all the way from the tip of the tooth all the way to the inside where the center of the tooth is, that you can see, called the pulp chamber. Okay, and then that can be done sometimes in one visit, and then other times in 2 visits. So it's really depending on the situation. And so once that's done, we put the big filling in the middle called a core buildup, and then we put that cap. So we shave the tooth down and then put a cap over everything. That's generally the process for root canal, and then its eventual restoration with a crown. And so in the video that follows, we're just looking at what it's like to get a root canal. I mean, the patient will already have the rubber dam on, and it really will just be a lot of noise, and you'll see that we're just drilling a hole in the top. And what happens later, we start cleaning it with a tiny little instrument called files, and using other things called irrigants or irrigation materials, namely bleach. Okay, so I hope you enjoyed the video. Thanks for watching. Alright, so at this moment we've already placed that little barrier that goes between the tooth and the rest of the mouth. We've already drilled a small hole in the middle of the tooth to access the infection and the nerve that's at the center of the tooth. Okay. And all we do at this point is clean it out. Simply take that hole a little bigger so we can get our instruments in. We sterilize the inside of the tooth from the part that we can see all the way to the tip of the root. And we place a little filling that goes all the way from the tip of the root back up to the middle of the tooth. Okay? Once you go numb, you really don't feel too much. You can think of the root canal therapy kind of as a filling. It's just, instead of just being on the outside of the tooth, it goes on the inside, all the way to the part of the tooth, the root, that we cannot see.